Bahija Gouimi. I am myself a CML patient since 2002. And since then, I experienced different challenges as treatment access, care centralization, bureaucracy, stigma, lack of blood test, PCR test, and psychological support. And all these reasons motivated me to create AML Association based in Marrakesh, Morocco, dedicated to support and educate CML patients and families. And in 2008, I joined CML Advocate Network and the global patient community to represent African Middle East region and help to understand the local needs. And my only vocation consists to raise awareness and reduce the care gaps, engage also with all stakeholders and advocate for better access. Actually, the results didn't surprise me because we are experiencing this every day with our patients in the Middle East and Africa region. In general, in low and middle income countries, patients are often viewed as objects of care, and in the best cases, unserved clients in the private clinics. And also, doctors are often viewed as God, as infallible, and a patient may not feel comfortable asking, questions about how to manage treatment and side effects, their fears, also doubts and psychological effects. And the majority of doctors complain about lack of time, as they may see more than 60 patients a day. And sometimes a patient do not receive enough information or clear information about their treatment, including, for example, how to take their medication, how to identify also short-term versus, for example, persistent side effects and toxicity of treatment, and what to do if they experience severe side effects. We have also some bad experiences with patients. Some patients may not take their medication as prescribed by their doctor and may hide the truth about their side effect to avoid being switched to a more expensive or available treatment in the country. And also, we have other patients may pretend to take their medication, but the reality is something else, and they can't achieve the deep molecular response or may develop resistance of treatment. Also, in my region, patient may suffer from stigma. They need more time to understand the treatment and the side effects. They are also suffering from illiteracy and poverty and lack of health insurance and centralized care. They have to travel to see doctor many times, and other repercussion of cancer on their lives and quality of life. And sometimes doctors and patients may not speak the same language, leading to misunderstanding. For example, if a doctor says it is maybe be careful, just saying this sentence, be careful, the patient may interpret this as it's critical, maybe I will die. And this is a big difference in what doctors perceive it as concerns and real impact of side effects. CML is now considered a chronic disease, and patients require a close relationship with their doctor to discuss treatment and side effect management. And patients need a reassurance from their doctor, and both patients and doctor need to share decision about treatment. This is the most important things. I mean, education is key for both patient and physicians. Patients with CML require a multidisciplinary approach to their care. And education for sure is an important component of this approach. Patients need to understand their diagnosis and the treatment options and potential side effects. As I said before, we have some toxicity about side effects, and patient may hide this side effects and the toxicity, or not taking their medication. They also need to know how to manage their symptoms and when to seek medical attention and information, because sometimes they are lost. They don't have any choice, and they don't have any information. I think education is the key, and education for both patient and physician. And physicians needs to provide also clear information to their patients and encourage them to ask questions according to their education, because we have a huge and important rate of illiteracy, and people can't understand the language of physician. Maybe a doctor needs to provide this clear information, and also according to their education level, and also cultural setting, because of stigma. And patients should be encouraged to keep a diary of their treatments and symptoms and side effects, which can help physician adjust their treatment plan. For example, if they have side effects, we can manage doses and so on. I am a dreamer. I have a lot of things, but I believe that shared decision making between healthcare physician and patient is essential in the same treatment, because now we have many generation of treatment, and we need to take the decision. Patients and physician, they are partner in treatment, and patients should be involved in the treatment process and be treated as partner in their care. For example, I will share with the doctor will share with his or her patients, all treatment and option, and talk about side effects, and talk also about fears, about doubts, about also doses, and what happened, because we have many different ways how to think, because doctor think that the patient is thinking like himself, but it's wrong. It's totally different. And I think the success of CML treatment depends on a high degree of patient involvement and motivation, the motivation also, as well as strong collaboration between, I think, patients and doctors.